Hello, I'm Dr. Lianne Catton, the Medical Officer of Health for the Porcupine Health Unit, and I just wanted to check in today to provide another important update with respect to the COVID-19 pandemic across the Porcupine Health Unit region. At this point in time, we have been very pleased to have several days steady at a confirmed total of 65 cases of COVID-19. While any day that we're not announcing a new case or sharing a tragic loss is always a good day, we need to take this with an abundance of caution. We need to recognize, celebrate, and thank everyone for the committed measures that led us to this point. And we need to remain committed. We need to remain steadfast in the measures that got us here. The important measures of washing our hands frequently, practicing physical distancing, staying home when we're unwell, and just being extra cautious to prevent the spread to every single community member, especially those more vulnerable and at greater risk, is still absolutely critical. We have been working with retirement homes this week to support the surveillance testing initiative and are working with other congregate living settings as well to ensure testing is available and accessible to all those who may be at greater risk for this infection across the region. The Porcupine Health Unit continues to promote testing in all individuals across the region with even mild symptoms. And last weekend, we heard the Premier announce more widespread testing would be available for even those without symptoms related to COVID-19. This means that any individual across the health unit who's concerned they may have been exposed or they may be at risk of being exposed to COVID-19 can get tested. There are assessment centers in many Porcupine Health Unit communities, and the Cochrane District EMS paramedicine program continues to work with the Porcupine Health Unit to ensure access to testing for all community members who either have symptoms or are concerned that they may have been exposed. We want to assure you that nobody will be denied access to testing. However, many assessment centers are continuing with the appointment basis in order to promote infection prevention measures, prevent lineups and gatherings at assessment centers, and in order to ensure efficiency of the testing procedure itself. We will provide further updates tomorrow on our website and social media pages, as well as through community partners for the contact information, times, processes, and locations of assessment centers across the region. These are also available on a Ministry of Health website. With respect to the testing, and especially now that we are seeing more testing being completed in those that have no symptoms for COVID-19, there are a few really important reminders. One is that a negative test, while it is reassuring, can only be reassuring for the day the individual had the test. It tells us that on the day the test was done, this individual does not have COVID-19. It unfortunately does not tell us about any prior infections with COVID-19, nor is it any indication of not being able to become infected with COVID-19. That being said, it's extremely important that even with a negative test, we all need to continue to follow the important infection prevention measures. A negative test does not mean that we can go on to visit. It does not mean that we can let up on physical distancing, washing our hands, staying away from those who may be more vulnerable or at risk. A negative test is reassuring for the day the test was done, and otherwise we must remain committed to stopping the spread of COVID-19. With this, we know that while we do want to see increased testing across the region, as this will help us move forward, it will help guide and inform the next steps in the pandemic. It will help demonstrate and provide further information with respect to those that may be at greater risk for this infection. We still need to remain committed to the infection prevention measures, the public health measures that really have been proven and are evidence-based to reduce the spread of COVID-19 and prevent tragic outcomes. Regardless of any testing that is done, regardless of the positive news of not announcing new cases across the region, please remember the most effective proven methods to preventing COVID-19 for you, your family, your friends, your loved ones, and those in our communities that are at greater risk remain the same. Wash your hands often and well. Please refrain from touching your face unless you have clean hands. When you're outside and in public, whether it's in a local business or workplace or outside enjoying fresh air, please maintain physical distancing of 2 meters from those that are not within your current household. If you're unable to maintain that 2 meters of physical distancing, we are recommending a face covering, a non-medical, non-surgical mask, or a cloth mask that is homemade. And we will be providing some information on how individuals can make those on their own as well. Please make sure that if you are going to use these cloth masks or face coverings, that you do so safely. Make sure that you are washing your hands prior to putting them on and taking them off, that you're not touching your face or adjusting the mask with dirty hands. We know people are really excited to get back to some sense of normalcy. We know that people are craving that social connection, that connection with work and structure and function, and get back to life events that we are also used to celebrating. But please, if you are unwell in any way, stay home. Call to get tested. Don't expose others. Stay home and help us prevent the spread and save lives. Thank you again to all the community partners, community members, the contacts, the cases, everyone who's been involved. It is absolutely critical that we all continue to work together. The commitment and support of everyone in every community has been tremendous, and it really does make a difference. We are all in this together. We need to continue working together in order to prevent the spread and save lives. Thank you. Merci. Miigwech.